Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome. Today we are talking about our new conference up and coming. We've got our Gold Birth and Beyond 2020 just around the corner starting on October 5th. And we can't wait for all of you to join us for that conference. You can find out all the details at goldbirthandbeyond.com. Check out right now, go online and you can check it out for all registration. Well, a big welcome to a special guest today, Maria Caterina Cattaneo. Welcome, Caterina. It's good to have you here. I know that you are in another part of the world to where I am today, and I appreciate you taking the time to sit down and chat with us. I do want to let folks know that Caterina is going to be with us at our upcoming conference as part of our very special add-on package titled Preventing and Healing Trauma in the Perinatal Period. Welcome, Caterina. It's lovely to have you here today.
Thank you very much. It's a pleasure. It's my pleasure.
Now, you're speaking on a very specialized topic, but this is something that I have seen over the years and don't know a lot about. The title of your presentation is EMDR, Recent Birth Trauma Protocol. And I know that you're going to be talking about other things, and we'll catch up and talk about those things in just a moment. But I would like to ask you some questions about what life looks like for you today, and where you are in the world. You need to let folks know where you are now and tell them what you do there.
Okay, I am in Italy, in Lecco, which is a town along the lake of Como. Okay, I don't know, maybe you know the place.
Beautiful.
And I am a psychologist, a psychotherapist, and I work here and I work in Milano in a hospital, in a maternity ward. And I have been working there more than 10 years, so a large experience in maternity ward.
Yes, absolutely. And I know even looking at your bio about your experience and where you work and what you do, I mean, this is phenomenal. So I certainly hope folks will take a look at that on our website. But I do want to talk a little bit about, the project that you've worked on when birth becomes a crisis. And I know this is part of your presentation, but can you really tell me when this, when did you start looking at this project? And why has this become a passion of yours?
Yes, this is really important to me because the reason of my project starts in my life. When I had my second child, I had a big trauma because he died after the delivery.
I'm so sorry.
Because of a heart disease, very severe. And the gynecologist didn't recognize this disease during the normal ecography. So when this tragedy happened, I was left alone in the hospital without a psychological support.
Wow.
Nobody came to visit me and to speak with me. So time by time, after this experience, then I had another child. And so in a way I have a recovery of this, but time passing, and I had the idea that it is really important to be there, to have a psychologist when this big trauma may happen in a maternity ward, in delivery room. And so this is the reason of my passion for this project. Right. And I try to structure this project, and I try to really improve, structure a very precise model to best intervene in this kind of situation.
Well, I mean, that story personally touched me so much. I am a mother of a child who has heart disease, and he
Okay.
survived. So I, my sorrow and my grief to you on losing your child and not having that. I've also witnessed birth in my time as a doula, Caterina, that has been traumatic for not only myself, but of course for the birthing parent. And we see this still today. It is absolutely amazing that you have this project, and that you're providing services. So could you expand a little bit on this in terms of what type of professional can, be involved in this project? Is it just a psychologist? Who are you training folks? What is happening around the project?
Okay, we nowadays we are 5 psychologists, psychotherapists,
Yes.
and we work side by side together. We are a very strong keep,
Mm-hmm.
and we work in maternity ward and side by side with nurses, with midwife, and with doctors, and this is really it's really a marvelous experience of how to cooperate together and how to put
Right.
in synergy or all our energy.
Yes.
And even if it's not easy, and it was
Yes.
very difficult to accept the figure of a psychologist inside a maternity ward in Italy
Yes.
is really, really difficult. So this is real, and I started in in 2006
Right.
in Milano, and it was hardly tolerated in the hospital, not by midwife, not by nurses, but by doctors,
Right.
gynecologists,
Mm-hmm.
most of all. They were very, very, it was very difficult.
Mm-hmm.
But we push and we we fight a lot, and I think that this was a great project,
Mm-hmm.
and really important. I don't know how in another word how to say in another words.
Yeah. Well, I mean, I can certainly relate to the importance, and thinking about it, you're absolutely right. I can't remember a time that I was at a birth, perhaps there was a death as well involved, where there would have been a psychologist involved. There were lots of people, but I know that, I mean, this is, it's very overwhelming, and there doesn't need to be a death. I mean, there are many traumatic births that take place or can take place where, where it's very depleting for not only the birthing parent, but for the parent on the sidelines, perhaps the extended family. So I can only personally see what great benefits that this would have. So I'm definitely very much looking forward to hearing more during your presentation about, of course, how this works. And thank you so much for sharing a little bit about what you're doing. It's exciting to hear, and I hope that there are people that are listening that either can share that they are doing this as well, or that they want to do this and find a way to set up a project like yours. That would be wonderful to see more projects like this internationally and around the world.
Yes.
I want to ask you a little bit about your actual presentation and a little bit about the title as well. EMDR, Recent Birth Trauma Protocol. Can you briefly explain what this is and what we will be learning, just in a very small time here?
It's a little bit difficult in synthesis, but I will just a few words.
Sure.
Me and my team tried to structure a very focused intervention in maternity ward, and after some years, we have improved our preparation as a psychotherapist
Mm-hmm.
by learning EMDR therapy. And then we added inside a usual treatment, usual clinical interview, we added the EMDR.
Right.
Because this technique, this therapeutic technique, can really be very focused. And
Mm-hmm.
we don't, I will explain it after, we don't have much time to make our clinical and therapeutic intervention. But this is a therapeutic intervention, even if we have only one long session. And this is very important. We have
Mm-hmm.
many cases. It's incredible how many resources can activate a process like an EMDR protocol in perinatal psychology. So this is very, very, I think, we love this work. That's all. Because really, it's. I would like just to add this. It's when women help women, because we are my team. We are women,
Ah.
and we help women, and we increase the possibility to heal critical knot,
Mm-hmm.
critical situation, and just we are together
Right.
to okay to heal and to go on with our baby.
Yes, yes, it can be a strength, I feel, amongst the women in order to move forward. So I certainly can appreciate that as well. Well, thank you so much, Caterina. I know there's so much more to come, and therefore we invite all of you that are listening right now to join us at our Gold Birth and Beyond conference. And once again, goldbirthandbeyond.com is your website to go to right now and register for this conference beginning on October 5th. You can also listen to the recording. So if you can't come to the live event, it will be available for you, including Caterina's presentation, of course, will be available to you online at your convenience. So you'll be able to watch it whenever it works for you. Thank you once again, Caterina, for sitting down with us here today.
Thank you, Fiona. Thank you.
And thank you to all our viewers. It was wonderful having you back here once again, and we look forward to sitting down with our next guest soon. Bye-bye for now.